Okay, we're going to begin. Can everybody hear me?
Yes, we can, sir.
Okay, so just to begin, I'm going to introduce the assembly members of this of the conference committee. In addition to
And as soon as
Assembly Insurance Committee, Ron Kim, Chair of the Assembly Aid Committee, Maritza Davila, Carinas Reyes as an alternate, Daniel Rosenthal as an alternate, Kevin Byrne, the ranking minority member of the Assembly Health Committee, and Jake Ashby as an alternate. Senator, over to you.
Thank you, Assembly Member. In my side, Gustavo Rivera, Chair of the Health Committee and co-chair of this conference committee, and joined by Neil Breslin, Chair of the Senate Insurance Committee, Rachel May, Chair of the Aging Committee in the Senate. So also joined by Peter Harcum is not able to join us, which is why we have our alternate, Cordell Clear. Senator Clear is on as well. And we have from the minority, we have Senator Patrick Gallivan, ranking member in the Health Committee.
Okay. I think the first order of business is appointing the respective Assembly and Senate recording secretaries for the conference committee. And for the Assembly, the recording secretary of the conference committee will be Stephen Meth of our program and council staff.
In the Senate side, it would be someone who is not my cousin. Jorge Rivera will be the designated recording secretary for the Senate.
Okay, and just as a procedural reminder to everyone, this conference subcommittee has nominal jurisdiction over the budgets of the Department of Health, the Department of Financial Services, and the State Office for the Aging.
Some general guidelines. Oh, go ahead, sir. Go ahead.
No, you go ahead, Gustavo.
So some general guidelines for conference committee. We have all received and are at length. You have received them. I will just read them, not the whole thing, but just so that we're clear. One, co-chair shall determine all matter of parliamentary procedure unless otherwise specified by these rules. Two, co-chairs shall each designate a staff person to serve as secretary for the purpose of taking minutes. That has already been done. Three, an alternate may participate in a subcommittee meeting but shall not vote upon any deliberations of such subcommittee unless he, she, or they has been designated to fill an excused vacancy in such subcommittee. Number four, no subcommittee members or alternate members shall be permitted to participate via proxy. Number five, subcommittees shall restrict their deliberations to their respective subject areas as determined by the General Conference Committee. Number six, each member shall be permitted a reasonable period of time as determined by the co-chairs to discuss any matter germane to the subject area of the subcommittee. And last but not least, seven, no report shall be filed except upon the affirmative vote of a majority of the members of each house's delegation on the subcommittee.
Okay, so the only thing I want to add is, just as general remarks, this is the 35th health budget that I've worked on as health committee chair. It is certainly the budget that Governor Hochul submitted is by far the best health budget I've seen as health chair. There's a lot of really good things in what the governor submitted, and the assembly and has accepted an awful lot of what the governor has put forward. And of course, what I've also said from the start is that while the governor's budget was really very good, it did not quite achieve perfection. And hopefully the proposals that the Assembly and Senate have put forward to expand the governor's budget will bring us a lot closer to perfection. So that's what I have to say this afternoon.
Thank you, Assemblymember Gottfried. I will only add, I have certainly, first of all, ditto to everything that the Assemblymember said. I will only add that when you consider that the last 10 years, the last decade has been, particularly as it relates to this, well, certainly across the board, but certainly as it relates to everything under the purview of this particular subcommittee around health, mental health, developmental disabilities, et cetera, there has been disinvestment, kind of an austerity mentality that has ruled the day. And we have, and the governor did a very good job of presenting us a proposal to start going in the opposite direction. And as the Assembly member said, is a good start. But both the Assembly and the Senate proposed certain things to add to it. And I would just underline that these are investments in long-term stability of something that is essential to keep stable. And we're hoping that working along with our colleagues in the Assembly as well as the governor, that we in the next couple of weeks will be able to come to a conclusion in a budget that will certainly start moving us in the right direction even faster than the original governor's proposal. Assembly member?
Okay, I don't know if anybody feels the need to add anything to this procedural opening session. If not,
so I can see how since I can see all the different screen. I know that my colleague, the ranking member in the Health Committee in the Senate, Senator Patrick Gallivan, wants to make some statements. I will allow that to happen now. And if since I can see as well, does the Assembly wish to do the same? Member Burns says yes, so I will pass the baton to Senator Gallivan. Senator?
Thank you, Chairman. Good afternoon to all of my colleagues. This is a significant portion of the budget, as everybody knows, and in representing the Senate Minority Conference, I want to express both some concerns and some things that we're very pleased about. Regarding concerns, there are two areas. Both of the one house of the Medicaid global cap. I know it's certainly important to ensure New Yorkers have access to quality, affordable health care. Eliminating the cap, though, has the potential to lead to more waste and inefficiencies, which could ultimately lead to unsustainable growth. I think that's an area of concern for us to pay attention to. The other area, another area of concern, has to do with the nursing home reforms that were implemented in the past couple of years in the one house budget. We know that the pandemic has really challenged nursing homes. And we also know that we have a staffing crisis. We have a workforce crisis, rather, and the staffing requirements of 70-40 law, I think, have the potential to put incredible negative pressure on the nursing homes that could lead to closures, something that I think we should be paying attention to. There are a number of things, though, that we're very pleased about. The rejection of the proposed competitive procurement of the managed care long-term care plans is a very positive thing to avoid a negative impact on those taking care of some of our most vulnerable people. The rejection of the funding cut for excess medical malpractice pool and the restoration of prescriber prevails, we're very pleased to see. We're pleased with the Doctors Across New York program, nurse loan repayment program, and the Empire Clinical Research Program to support the healthcare workforce recruitment and retention. And the last area that I do want to mention is the inclusion of funding for distressed and safety in hospitals to ensure hospitals are able to recover following the pandemic. The one area of concern that we had considerable discussion and debate in the Senate is to make sure that is to pay attention that we are very careful in determining how to distribute this funding so that we're able to help all the hospitals across the state that have the need. But thank you for the time, and I look forward to working with everybody to solve a lot of the problems that our constituents face in the world of healthcare.
Thank you, Senator Gallivan. Assemblymember Gottfried, I know that Assemblymember Byrne wanted to chime in.
Yeah. Kevin, go ahead.
Right. Thank you, chairs. I know the Assembly of Minority Conference mirrors some of the concerns that were expressed by our Senate colleague, Mr. Gallivan. We have concerns about the elimination of the global cap on Medicaid. The enacted budget should include safeguards to ensure that Medicaid does not grow at an unsustainable rate. The state has also been behind on providing Medicaid reconciliation to the counties. The executive's proposal does include steps toward addressing this issue, but our conference supports returning the full reconciliation amount to our county governments. Our conference also supports the proposed change that would support distressed hospitals, as was said earlier, but without relying on the sales tax diversion or intercept from county governments. The legislature included proposals in their one house budgets to allow individuals to access the essential plan regardless of immigration status. That's specifically the Assembly one house. Without a proper way to verify income for this initiative, without any federal support, and paired with the possibility of this change incentivizing more individuals to come to New York in order to access this program. The Assembly Minority Conference has some serious concerns over the possible rising cost to this program, and by extension, increased cost placed on the backs of New Yorkers. The Senate did not include this provision in their one house, and we agree with its exclusion. The Assembly minority supports the funding to address challenges in the healthcare workforce and supports sustainable workforce initiatives for these workers. This should include support for nursing homes and assisted living facilities. The Assembly minority is pleased to see the legislature omit the executive proposal to eliminate prescriber prevails and restructure the excess medical malpractice program. As was said earlier, we know nursing homes are currently struggling with widespread staffing crisis, which has been exacerbated from revenue requirements imposed by last year by the legislature. The Assembly minority supports examining methods to alleviate this fiscal stress for nursing homes. Financial support for our frontline healthcare workers, as I said earlier, including nursing homes and assisted living facilities to help offset COVID-19 related expenses, should also be considered in this final budget. The Assembly Minority Conference also has long held the belief that there should be a thorough review of the state's pandemic response. There's some legislation that's been introduced, I believe, in the Assembly on this that should include a review on nursing homes, and funding for such a review needs to be included in the state's budget. And again, on one final note, I do want to thank the Assembly majority for including not only funding, but the statutory language that reestablishes the Adult Cystic Fibrosis Assistance Program, which in my opinion was irresponsibly eliminated in the 2020 budget during the midst of a pandemic that attacked people's respiratory system. While the funding was restored in last year's budget, the program language was not. And while the Assembly majority, the Assembly One House resolution included it, the governor did not. I do not believe the Senate did either. I implore Governor Hochul and our Senate colleagues to include this in the final budget. Thank you.
Okay, unless, Gustavo, unless you see other hands raised, I think we are ready to adjourn.
Do a quick glance, and I do not. So we are indeed ready to adjourn.
Okay, apparently we adjourn at the call of the General Conference Committee.
All right. Have a good afternoon, everybody, and safe driving to
Okay.
those that are on the road.